Hello, we are with our guest, Professor Dr. Navid Shahnaz today. I would like to thank him for accepting our invitation. Now I'd like to begin my questions. My first question is, how did you meet audiology?
Well, it was way back when I was actually I was a student in Iran, and it is a national exam to get an entry into the university. And based on my grades in the national exam, I selected several different fields, including audiology. So I wasn't sure what the audiology means and what it actually brings forward. But once I got into the program, I got very interested. The reason that I got very interested was that it had components that deal with technical issues as well as the art of interacting with human beings. So depending on what you like, it can actually cover all areas of interest for you. So that was my initial contact with audiology, and as I started the program, I started to love it and excel in different areas. And once I finished my bachelor degree, which was a professional degree in Iran, I worked for about 6 years there in different private and public sectors, and then moved to Canada to do my master and PhD at McGill University in audiology.
So that's how you met. My next question is, in your opinion, is only audiology education sufficient to succeed in the field of audiology? If not enough, in which areas should we support ourselves?
It's just a start. Like getting your professional degree in the field is a start, right? Then you have to find your passion. See where your passion lines up with the field. The good thing about audiology, dealing with different age groups, baby to toddlers, to children, to adults, to old or geriatric populations. And then you can deal with assessment, rehabilitation, and that's not only the scope of practice, you can deal with balance and intervention. So along your way, you will find ways to interact with other professionals, excel in other continuing education besides what you have learned at school. So just not learning at school is going to be enough. Is to learn how to deal with patients, have empathy, have a way to interact with other professionals in the field, and try to stay abreast of evidence-based practice, because things will not stay status quo. It will change. You want to be on top of it. So you have to revisit what you do on a daily basis, or at least on a yearly basis, and change the way that you practice. So all those things will make you fluid rather than static, and make you a better audiologist.
My third question is, what would you advise to audiology students about their careers? What path should they follow in career planning?
Well, there are different pathways that you can take. As you know, audiology is a very versatile field. You can engage in industry as research and development audiologist, in sales, in technical consultant, in industry. You can be a public figure advising government of a change in policies. For example, WHO advised that there is this public burden of a hearing loss among young folks because of listening to music at a high level using personal listening devices. So audiologists play an important role going to the school, educating the policymakers to make changes, to make a better practice. You can actually get involved in public sector hospitals. So that hospital could be dealing with babies, universal screening program. You can deal with children following a screening someone has to determine the type of a hearing loss and then what is the course of actions or rehabilitation. As you go up in age group, children, central auditory processing, as well as other middle ear infections that could actually interfere with the way that the children can actually progress in their education. So audiologists play an important role in screening, in advocating educational system. Also, audiology plays an important role in corporate implant. So there are different fields that you can get involved. I think one side of the field which has not been tapped into, even in North America, is balance assessment and intervention, which is a huge area that has been untapped and needs to be actually addressed. As you know, one of the main issues as we grow older is fall injuries. And audiologists play an important role in assessment and rehabilitation along with physiotherapy. Another aspect of audiology which has not been tapped into is tinnitus and hyperacusis assessment and intervention. And that also needs to be addressed. So there are different things that you can get involved. And often audiologists feel that the hearing aid prescription and fitting is the job of an audiologist. That's a fraction of what audiologists can do. So the field, I think, is infinite. You just have to find your passion, where you want to get engaged, and you can excel in that area.
Thanks, sir. My fourth question is, what are your suggestions for making a difference in the field of audiology?
So if you want to make a difference in the field of audiology, you should not stay static. You should be dynamic. And what I mean by being dynamic is that you have to be abreast of what's going on in the field, what's happening, what you can do to change the way that you practice to make things better for your patient. So continuing education, reading the literature and keeping yourself abreast of new methods, protocol, and assessment. So be able to talk to your profession, be able to talk to other professionals, interdisciplinary type interaction. So in case of balance assessment and management, for example, you want to deal with ENT and physiotherapy to be able to work together to set up a proper assessment protocol and intervention for them. In terms of central auditory processing, you want to deal professionally with speech-language pathologies and probably other interventionists to be able to provide a better assessment and intervention. Same thing with cochlear implant. You're dealing with surgeons, you're dealing with SLPs, auditory verbal therapists, and audiologists for mapping and providing a better picture for cochlear implant. So being able to stay on top of things, being flexible enough to change the way you practice, have sympathy for your patient, listen to them, and try to make a difference. The best way that we can would be an excellent way for audiologists to excel in their careers.
That was very helpful. My next question is, could you share your 3 golden rules for life in general?
Oh, that would be a tough question. In terms of the golden rules for the profession, and that varies from one person. I think treat others with kindness and respect. I think that's the first thing. You want to be treated the same way that you want to treat others, and that will take you a long way. So practicing kindness, you can foster a good relationship with your client, with your rapport, and create a harmonious environment for your patient and your colleagues, and make a positive impact in your clinic and around the world. Continuously seek personal growth, so don't stay static. Learn. You're a lifetime learner. So once you're graduated, your journey is just starting. It's just not the end of it. So embrace a mindset of lifelong learning and personal growth. Strive to expand your knowledge, develop new skills, challenge yourself on a daily basis. You have a great potential, so the only one can tap into is you as an audiologist or as a human being. Be open to new experiences. So don't try to restrict yourself in the boundary of what you have been taught. Things change. And you have to be flexible enough to be part of that change. There are ups and downs in your life, so you have to be able to overcome obstacles and continuously learn and grow. And maintain a balance in your life. So your life is not in the clinic. You have family, you have other responsibilities. So providing balance and your self-care is also important, because if you're not taking good care of yourself, you can't take good care of your patient. And that has been proven during the COVID pandemic. So self-care is very important. Nature relationship with your colleagues, your family members, your patient, and pursue your passions. So if you like an area you feel, pursue that. Don't procrastinate. Try to actually take positive steps to achieve that. So the golden rules that I mentioned varies from one individual and the other, but these can actually provide a more meaningful pathway toward a better human beings.
My last question is, what are your expectations from young people in the field of audiology?
Commitment to excellence. That's the first thing that it comes to my mind. So don't try to get by. Strive for excellence in your work and maintain a strong commitment to providing the highest standard for individuals with hearing-related issues. Stay up to date about the research, what's going on in the research. What is the most recent technological advancement that you can put in use to provide a better care for your patient? What are the best practices in audiology? Your test protocol should change on a yearly basis based on new evidence. So continuously seek professional development opportunities. Don't stay in your clinic and in the boundary of your role. Have empathy and patient-centered care. So you have to develop communication and interpersonal skills. If you cannot establish a good rapport with your patient, they're not going to be in a position to listen to you. So you have to establish that relationship with your patient. So this patient-centered care is one of the most important aspects when you start practicing and dealing with patients. Collaboration and interdisciplinary approach. So don't say that I'm the one that has to do everything. No one can do everything. You need the help of other colleagues and professionals to make a better care for your patient and yourself. So recognizing the value of collaboration and interdisciplinary work in audiology makes a big difference. And I think finally, advocating to the public, to the policymakers, and go into the community. So your job is not going to end in the clinic. If you know that there is a global burden of hearing loss as identified by WHO, then you need to be active, go to the school, educate the kids at a young age to change their habits. Talk to your policymakers, tell them what potentially happen, how much money they could potentially save by initiating some policy of limiting, for example, the output of personal listening devices that are coming to your country, for example. And be a lifelong learner and involve research. It doesn't have to be a sophisticated research. You could address simple questions. So you can always get involved in those. So all those things can actually make a positive impact, in my view.
Thanks, sir. So that was it, all my questions. Thank you for participating to our people contribution to audiology project. We have been enlightened from your experience and advice.